Resuscitation of newborn. The goal of pediatric resuscitation is to maintain adequate oxygenation and perfusion of blood throughout the body, while steps are taken to stabilize the child and establish long-term hemostasis. The most common indication for neonatal resuscitation is asphyxia. Second most common, prematurity. The components of neonatal resuscitation are TABC. T for maintenance of temperature, by radiant heat source, and by drying the baby with removal of wet linen. A for airway establishment of open airway by placing the neonate on his back with slight extension of neck done by elevating the shoulder 3/4 or 1 inch of the mattress with the help of rolled blanket or towel. Then suction of mouth and nose is done. B for initiate breathing, tactile stimulation is given, and when necessary endotracheal tube can be used. C for maintain circulation, this is done by chest compression and / or medications. Resuscitation protocol. As soon as the baby is delivered, 5 signs are assessed. 1. Clearance of meconium. 2. Active breathing or crying. 3. Good muscle tone, flexed posture, and active movement of baby. 4. Pink color look at tongue and lips. 5. Term gestation, delivery between 37-42 weeks of pregnancy. If all signs are positive, no active resuscitation is required. If any of the 5 signs is absent, baby requires resuscitation. The baby should be placed under the heat source, radiant warmer, and subjected to initial steps. Initial steps of resuscitation. Postjoining. The neonate should be placed on her back or side with the neck slightly extended. This can be achieved by putting a rolled blanket or towel under the shoulders, elevating them 3/4 or 1 inch off the mattress. Suctioning. The mouth and nose should be suctioned. The mouth is suctioned first to ensure that there is nothing for the infant to aspirate when the nose is suctioned. One should not insert the catheter very deep in mouth or nose for suction. Stimulation of posterior pharynx during the first few minutes after birth can produce a vagal response, causing severe bradycardia or apnea. Therefore, during oral suctioning, a suction tube is gently introduced into the baby's mouth until the 5 cm marking is at the baby's lip. During nasal suctioning, a suction tube is introduced up to 3 cm marking into each nostril. Then dry, stimulate and reposition. After suctioning, the baby should be dried by using pre-warmed linen to prevent heat loss. A brief tactile stimulation in the form of flicking the soles or rubbing the back may be provided in case of non-establishment of respiratory efforts. Then free flow of oxygen is given if the baby continues to be depressed. Provide free flow of oxygen using a face mask. After providing initial steps, the baby should be evaluated for 3 signs. 1. Respiration. 2. Heart rate. 3. Color. If baby has good breathing, heart rate is more than 100 and pink color, he should be given supportive care. If the baby is not breathing well or heart rate is less 100, then back and mask ventilation is needed. After the infant has received 30 seconds of ventilation with 100% oxygen by back and mask, evaluation of heart rate should be done. Heart rate is more 100, discontinue ventilation if spontaneous respiration is present. Heart rate is between 60 to 100, continue ventilation. Below 60, then continue ventilation plus chest compressions. After 30 seconds of chest compressions, the heart rate is checked. Heart rate is less 60, then continue chest compression and back and mask ventilation plus initiate medications. Heart rate is more than 60. Discontinue chest compression but continue back and mask ventilation until the heart rate is above 100. Resuscitation in newborn through meconium-stained liquor. When baby passes meconium in utero, there is a chance that the meconium will be aspirated into infant's mouth and potentially into the trachea and lungs. Appropriate steps must be taken immediately after delivery to reduce the risk of serious consequences resulting from aspiration of meconium. Intrapartum nasopharyngeal suctioning, just after the delivery of head, is no longer recommended as it does not reduce the risk of meconium aspiration syndrome, and, on rare occasions, may cause nasopharyngeal trauma, or a cardiac arrhythmia. First step after delivery is to identify whether the newborn is vigorous or non-vigorous. Vigorous newborn. A newborn is classified as vigorous if he has all the three signs are present. 1. Strong respiratory efforts. 2. Good muscle tone. 3. Heart rate greater than 100. The vigorous child does not require any tracheal suctioning, and the usual initial steps of resuscitation are provided, that is, we provide warmth, positioning, suctioning of mouth and nose, not tracheal suctioning, dry, stimulate an O2 if necessary. Non-vigorous newborn. If any of the above three signs is absent, the newborn is classified as non-vigorous. For non-vigorous child, the initial steps are modified. I place the baby under radiant warmer, and postpone suctioning to prevent stimulation of posterior pharyngeal wall that can cause bradycardia. Residual meconium in the mouth and posterior pharynx should be removed by suctioning under direct vision using a laryngoscope. The trachea should then be intubated and meconium suctioned from the lower airway. Tracheal suctioning is best done by applying suction directly to the endotracheal tube. After providing initial steps, the further management is same as with resuscitation for other conditions.
True regarding neonatal resuscitation. First nasal suctioning done. First mouth suctioning done. Maximum length of nasal suctioning is up to 3 cm and mouth is 5 cm. Maximum length of nasal suctioning is up to 5 cm and mouth suctioning up to 3 cm. The correct options are B and C. Next question. A baby is born with meconium-stained liquor. Which of the following is taken into account in terming a baby vigorous? Except a tone, color, heart rate, respiration. It is color. Next question. A 5-year-old child is rushed to casualty, reportedly electrocuted while playing in a park. The child is apneic and is ventilated with bag and a mask. Which of the following will be the next step in the management? Start chest compressions. 3. Check pulses. Check oxygen saturation. Correct option is check pulses. Next question. Intubate. Which of the following is the principal mode of heat exchange in an infant incubator? 1. Evaporation. 2. Radiation. 3. Conduction. 4. Convention. It is convention. Grimace with Apgar score is 0, 1, 2, 3. Correct option is 2. Next question. Which is not a component of Apgar score? A color of the body. Muscle tone. See heart rate/minutes. Respiratory rate per minute. Correct option is D. Next question. Which of the following is not true about newborn assessment? Apgar at 7 minutes indicates neonatal mortality depression. Apgar at 1 minute, indicators for neonatal resuscitation. C. Fetus can rapidly wash out CO2 through placenta. The anaerobic metabolism causes acidemia. Correct option is A. Next question. A newborn with respiratory distress with heart rate 86 per min, nasal, flaring, audible grunting, abdomen lagged behind chest respiratory movement, no lower chest or xiphoid retraction. What is Silverman-S score? 1, 3, 5, 6. Correct option is 5. Next question. Drug used in neonatal resuscitation. Adrenaline. Soda bicarbonate. C. Naloxone. All of above. Correct option is D. Next question. Neonatal resuscitation, which of the following drugs is used? A dopamine. Sodium bicarbonate. C. Noradrenaline. Darbutamine. Correct option is B.